What is a hyperbolic drug taper? My name is Dr. Ruth Zotton. I'm a board-certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting a psychiatric medication, as well as the importance of safety prescribing when clinically appropriate. And during my most recent series where I go through the informed consent process for a number of psychotropic medications, the question of what exactly is a hyperbolic taper has come up multiple times because I talk about it in these videos. So a hyperbolic taper, in contrast to a linear taper, is going to go down by a set percentage of the dosage with each dose reduction. Whereas with a linear taper, it's going down by a set milligram amount. So for example, let's say you're on sertraline, otherwise known as Zoloft, 200 milligrams a day, and you want to taper off. So a linear approach would decrease by 25 milligrams with each dosage reduction. So to 175, 150, etc., all the way down to 25 and then off. Whereas with a hyperbolic taper, you would decrease by a percentage. So usually we recommend starting around 10%. However, some people can tolerate much quicker, and some people need to slow it down. So with a 10% dose reduction, we would be going down from 200 milligrams to 190 milligrams, then to 181, etc. So why do we recommend this? Well, for a number of psychotropic medications, including antidepressants and other medications with antidepressant activity, as well as benzodiazepines, Z-drugs, and gabapentinoids, their receptor occupancy follows a hyperbolic pattern. So what that means is that the amount of medication that is biologically active, basically, and affecting the receptors is going to increase in a hyperbolic pattern. So that means that the receptor occupancy at a dose of 25 milligrams is not half of the receptor occupancy at a dose of 50 milligrams. It's actually much higher. And with each increase in dose, the relative change in receptor occupancy is going to become smaller and smaller. So as you can imagine, when we are tapering off of a medication, we have to take the reverse approach, that we can take larger dose reductions in the beginning and we have to make them smaller and smaller as we get down lower. So that's why if you're decreasing by 25 milligrams with each dosage reduction, that may be totally fine when you're going from 200 milligrams to 175 milligrams. But once you're going from 50 milligrams to 25 milligrams, that's a 50% dose reduction. That's a whole lot bigger than it was from 200 to 175. So using a linear taper may be fine for someone in the beginning, but when it gets to those really small dosages, that's when it's going to become really challenging. And this is in pretty stark contrast to the general approach in medicine and psychiatry that, oh, it's just a 5 milligram Lexapro dose or a 25 milligram sertraline dose. Then it's a baby dose. It shouldn't be hard to get off of. But that's actually not true at all. It's at that time that you really have to take your time to get off these medications. And like I said, this isn't everyone. Some people are able to tolerate a much quicker taper, but for people who've been on these medications for years and years, the best thing to do would be to take a more conservative approach and use a hyperbolic taper. I think it's not going to hurt for anyone to take this approach, but the longer that you're taking a medication, the more likely you're going to be at risk of symptoms of withdrawal. And we don't recommend white knuckling it through withdrawal because then you're putting yourself at risk of something called protracted withdrawal, which is essentially a brain injury that was caused by the abrupt removal of this medication. It can show up weeks to months later after you've gotten through the acute withdrawal period. So hopefully that answers your questions about a hyperbolic taper. If you have any other questions, or maybe you've had an experience with hyperbolic tapering and you want to share that in the comments, then please feel free to do so. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings or resources, and I want to be able to communicate with you all directly about those. So if that's you, then send me a DM with your email, and I'll see you in the next one.